So now we will be discussing on the role of high resolution ultrasound in dermatology. This is a very interesting topic, and recently a lot of work has been done on this, and we will use the ultrasound, how it is being effectively used to diagnose some of the cases in the skin. So the basic indications are the neoplasm, inflammatory diseases, infectious diseases, and the form of cosmetic dermatology. The thickness, invasion, depth, and assessment of the borders of the skin tumors and follow-up of surgery, cryotherapy, and laser treatment. Then there is also monitoring treatment of the disease with skin sclerosis such as morphea, systemic scleroderma, and edematous and chronic inflammatory dermatosis. Monitoring effects of topical and systemic drugs on the skin such as corticosteroids and estradiol. Also, in cases of allergic dermatitis, nodular erythema, dermatomyositis, sarcoidosis, lymphedema of the limbs, wound healing, scars, and follow-up of localized burns. It has a very important role which has been used for a long time for the foreign body localization and cosmetic fillers in the skin. The ultrasound can also be used in evaluation of nail involvement in the systemic disease and nail bed lesions such as glomus tumors, nail bed cyst, and subungual exostosis. High resolution ultrasound examination of each lesion should be done in detailed analysis by analysis the morphological study and analyzing the structural sonographic pattern and margins, measurement of the largest transverse diameter and thickness, color Doppler ultrasound for interlesion and perilesion vessels, and suspicious for malignancy, the surrounding areas are scanned for local lesional metastasis. This is how a normal anatomy of the skin looks like. The most superficial layer ecogenic, that is the entrance echo, that is called as the highly ecogenic band. Uh, Below that is the dermis, which is deeper layer, is rich in dispersed echoes of varying intensities. The hypodermis is the subcutaneous tissue and is anechoic or low echogenicity layer. So we should know this normal anatomy so that to differentiate between different layers and also to say which layers are being involved by the lesion. So there are various studies which have been done and they have different specificity and sensitivity. All of them really have a very high sensitivity and specificity for the ultrasound in the skin evaluation. Coming to some of the examples, this is a clinical image of a seborrheic keratitis where you can see the lesion is involving the dermis as well as the hypodermis. The margins are well defined. There is no calcification which is seen, and there is does not have any deeper extension. This is a case of cutaneous neurofibroma where you are seeing large number of nodular lesions in the skin. One of these lesions was analyzed in the ultrasound, which shows involvement of the epidermis as well as the dermis, which is going deep into the subcutaneous plane. Again, the margins are quite well defined, and there is no calcification seen. In case of a benign nevus, you can see that the clinical image is well defined, black, the dark looking thing, and on ultrasound, it is again involving the epidermis and the dermis, and it has a dip inside. The lesion has a well defined margin. The pilonidal sinus, the clinical example, if you can see, there is a large heterogeneous lesion which has a deeper extension, and then there is some inflammatory granulation tissue which is deep to it. So it is also involving the hypodermis. In case of pilomaxtroma, the lesion is well defined. It has some cystic component. As you see, there is a posterior acoustic enhancement. It is involving the hypodermis, though it is not involving the deep muscle layer. On color Doppler, you are able to see there is significant vascularity which is seen within the lesion and also the peripheral to the lesion. In case of invasive squamous cell carcinoma, you can see a large ulcerating mass. Ultrasound shows deep infiltration of the mass. There is well-defined margin and has all internal vascularity. In case of malignant melanoma, clinically it has a diagnosis on the clinical basis. On ultrasound, we need to see the extension of it, and also we need to see the metastasis. So as you see, the lesion is hypoechoic. It has significant vascularity within it, though it is not involving deeper hypodermis. In case of psoriasis, there are multiple scaly appearance in the skin, and you can see there is the thickening of the dermis. Whereas in case of the normal area, the epidermis and the dermis looks fine. In case of cutaneous lymphedema, there is bulging or the hardness which is in the skin. If you do the ultrasound, you can see there is increased thickness of the dermis as compared to the normal skin. So the recent trends in the skin ultrasound or the ultrasound is helpful in the dermatological aspect is contrast ultrasound, 3D reconstruction, and elastography. Elastography is used for the assessment of cutaneous pressure ulcers, lymphedema, and age-related changes in the skin. It is also used in cases such as scleroderma and other connective tissue disorders. So these are the various important references which have done some high quality work on the cutaneous ultrasound. So I would just like to conclude that ultrasound definitely has a very important role in the identifying the skin lesions, though they're more based on clinical diagnosis, but the extent of the lesion, the extension deeper, whether it is involving the epidermis only, the dermis, the hypodermis, or it's going deep into the muscular layer. So that can be assessed, and also the on treatment follow-up. When we have the base images, we can compare the post-treatment follow-up with the base image, seeing whether there is treatment response or not. Thank you.